Okay guys, let's talk about it. Hand, foot, and mouth disease, otherwise known as Coxsackie virus. You get a lot of parents that will come in complaining that the kid has had a fever, and they're developing this rash. And usually the fever started like 2 or 3 days ago, and then they came in because they noticed this rash that developed. And they noticed the rashes on the hands, the palms of the hands, and the soles of the feet. That is hand, foot, and mouth disease. Okay, so again, kids will have a mild fever. They can even have like conjunctivitis and pharyngitis as well, so they won't want to eat or drink. The problem is they can develop these rashes inside their mouth. It is highly contagious. Usually kids get it from daycare. It's an enterovirus, which means that it's transmitted through the mouth, fecal oral route. So butt to mouth. Kids at daycare, they dig in their pants, they put their hands in their mouth, and they get this virus. Highly, highly contagious. These rashes can last 7 to 10 days. So when I first started, I always had it was easy to diagnose this, only because I've had hand, foot, and mouth disease before. I got it from my kids when they're in daycare, and yeah, adults can get it. It's very contagious, and I didn't know what was going on. I developed these little macules. The hardest thing for me, like I was saying when I first started, is describing them. And so these are erythematous macules, okay? And they have like a gray oval shaped, kind of like a football shape, and they have an erythematous base, okay? So when you're describing them, you can describe them as a macule, oval shaped, gray macule, oval shaped, with an erythematous base. So when I got hand, foot, and mouth disease, I noticed the rash, the macules on my hands and my feet, and then my hands started tingling. And they became so sensitive I couldn't touch anything at all. Anything I touched, I would go to work, and just to hold a pen would be like almost impossible. I had to miss work, and my hands would peel. I could literally peel all the skin off of my hands. It was crazy. So treatment for this is pretty much, it's a self-limiting disease. It's a virus. You can just educate the parents that in about 7 to 10 days the rash will go away. The main problem that you're going to see is that parents will come in usually when the kids develop this rash, but also they develop this rash inside the anterior portions of the mouth and in the cheeks, as you can see there. And this is very painful for the kids. And so parents might say, oh, my kid's not drinking or eating, and you can understand that. They don't want to drink or eat anything. Main treatment is hand hygiene. So teach the parents about washing kids' hands, teaching the kids how to wash their own hands. And I have a 15 to 20 second rule with my kids. I tell them they have to wash their hands for 15 to 20 seconds, and they need to count. And that kind of just teaches them that, hey, you need to wash your hands thoroughly. The other thing is, usually when my kids had this, and with parents, you can just teach them, hey, a lot of cold beverages or cold food helps kind of numb these lesions up. There's nothing you can really give them. We used to be able to give them viscous lidocaine, but the problem with that is it worked too well, and parents would just overuse it, and kids would get lidocaine toxicity and possibly end up having a seizure. So I wouldn't suggest anything, and I know the parents are going to be like, there's nothing you can give. Unfortunately, there isn't anything. Just supportive care, hand hygiene, maybe cold beverages. Encourage them to give Tylenol or ibuprofen for pain. That might help as well. So these kids can easily get dehydrated. So when they come to you on the 4th day and they've had it, in their case, really, really bad, and they're not eating and drinking, take a look at the vitals. Make sure the kids' vitals are normal. If you got an elevated heart rate, you more want to consider kids getting dehydrated. Maybe you want to start an IV, or just, one thing I usually teach parents is give your kid 5 cc's every 10 minutes, 5 to 10 minutes. So if you have to give them a 5 cc syringe, go ahead and give them one, and get a cup of water and draw 5 cc's out, and have the kid swallow 5 cc's of water, apple juice, whatever, any type of liquid, and then do it again. Within 2 hours, that kid is actually hydrated. Okay, so that's a good teaching point for parents as well. But that's pretty much it. It's a Coxsackie virus, enterovirus, oral fecal route, hand, foot, and mouth disease. I'm out.